Together we achieve victory over heart failure.
Hello and welcome to our podcast. I am Dr. Chandrakant Chavan from Rhythm Heart Clinic, and today we are delving into a silent epidemic that India is combating, that is heart failure. In India, majority of the patients grappling with heart failure are surprisingly young individuals. It is a common occurrence into into witness young adults seeking medical assistance for heart failure, unlike the Western countries where heart failure is predominantly a disease of elderly. Let's break down 5 essential insights on heart failure. Firstly, what does it mean when a doctor tells you that you have a heart failure? When people get a diagnosis of heart failure, they think it's the end of their lives. The term heart failure can seem frighteningly, but it simply means that your heart is struggling to pump blood as effectively as it should. The ejection fraction or LVEF measures how well your heart pumps blood. It is the amount of blood pumped out of your heart's own chambers, that is ventricles, each time it contracts. When normal ejection fraction is around 50 to 70%, individuals with heart failure typically have ejection fraction of 30% or lesser than that. Secondly, why are so many individuals affected by heart failure? Genetics play important role. Indians are genetically more vulnerable to cardiovascular disease. Furthermore, hypertension, diabetes, obesity, and smoking habits worsen this epidemic. Thirdly, moving on to what are signs and symptoms of heart failure. Watch out for confusion, fatigue, heart palpitations, nausea, shortness of breath, and weakness. There is also loss of appetite or vomiting sometimes. Fourthly, how can we protect ourselves from this disease? Our heart works incredibly hard to keep us alive. There are 5 golden rules we can follow to return the favor. Early detection of heart failure through regular blood test, dietary adjustments to maintain heart health, incorporating daily exercise into your routine, practicing stress management techniques, and quitting alcohol, tobacco, and smoking. Fifth and lastly, what comes next after heart failure diagnosis? Thankfully, medical science offers numerous treatment options. It is possible to lead an enjoyable, meaningful, and productive life. Heart failure medications improve quality of life and longevity. Devices like biventricular pacemaker, implantable cardioverter defibrillator, that is ICD, and heart valve repair or replacement, and the last resort treatment option is heart transplant. The lifetime risk for congestive heart failure is 1 in 5 for both men and women. Remember, awareness and proactive measures are key to combating this silent epidemic. Thank you.